OMD. COPD Awareness Month. Orange is the color for COPD illness. And purple or lavender was for or is for pancreatic cancer awareness. But today we're talking about chronic obstructive pulmonary disease. So there are two categories. One is emphysema, the other is chronic bronchitis. And so emphysema is the disease process that affects the alveoli, or the small sacs that are at the end of the bronchial tree, that those small sacs carry oxygen. And when we develop emphysema, those small sacs typically will disappear or become larger. Therefore, they are less pliable and they have a difficulty transferring oxygen when they become large alveoli. The lungs will also become stretched out and or flabby. So they lose their ability to recover or recoil, or they lose their sponginess. And therefore, the difficulty in transferring or carrying oxygen creates the symptom of shortness of being, short of breath. So the air is trapped. And so the person feels that he or she is short of breath. That's when someone is diagnosed with emphysema. Usually, those patients have a thinner chest area or more narrow chest area than someone who has chronic bronchitis as their COPD diagnosis. Someone who has chronic bronchitis, their bronchial tubes are affected. And so the bronchial tubes are irritated or swollen, quote unquote, inflamed. And they also have little bitty hairs inside the bronchial tubes called cilia. And the cilia are lost, or they become unable to perform their duty of clearing the bronchial tubes of mucus production. So the cilia that helps to move the mucus as the inside the bronchial tube is lost in persons who have chronic bronchitis. So therefore, a cough is triggered because they're trying to cough up or to expectorate their mucus or their phlegm. And any amount of smoking can cause increased damage to someone who has chronic bronchitis. How do you know if you should be screened, or what should you do? Well, there is a test called the COPD Population Screener. It consists of 5 questions. The first question is, during the past 4 weeks, how much of the time did you feel short of breath? The second question is, do you ever cough up any mucus or phlegm? And the third question is, in the past 12 months, you or I do less than you or I used to do because of breathing problems. And then the fourth question is, have you smoked at least 100 cigarettes in your entire life? 100 cigarettes in your entire life. And then the fifth question is, how old are you? If you score less than 5, then you are doing well, and you generally don't have to discuss that with your primary care physician. But if you score 5 or more, then you can email the test study or the test questions to your primary care physician, and he or she can then start a workup for you related to chronic obstructive pulmonary disease, or as we call it, COPD. to discern why you've developed this issue. There are a couple of social media areas or places that persons can get help. One is COPD 360 Social, and the other is COPD Patient Powered Research Network, or COPD PPRN. So, again, chronic, long term, long standing, obstructive, something is blocked or preventing the mucus from being cleared. Pulmonary, the lungs, disease, damage, and unfortunately for COPD patients, it is definitely treatable, but there is no actual cure to date. How do you know if you have the diagnoses, or what are your symptoms? Shortness of breath, cough, wheezing, chest tightness, unusual fatigue, or tiredness. So if you've decided that you don't want to do the things that you used to do, you're not eating as much because you're having more difficulty with your breathing, you hear yourself wheezing or someone else hears you wheezing, you have some chest tightness, or you have a chronic cough. How do we diagnose COPD? We can use a spirometry. Those things are done some in an office. And then we can also do pulmonary function test, which normally is done at another facility. Or if you're seeing an asthma and allergy specialist, he or she may do those tests in his or her office. If you are seeing a pulmonologist, then they may also have a setup to do pulmonary function tests or spirometries within their office as well. But a formal pulmonary function test is done at a hospital or respiratory facility, or they seat you in a room or a space that's closed, and they allow you to take deep breaths and then blow into another apparatus as hard as you can to check your inspiratory effort and your expiratory effort as well. You would do that test several times, and they would do that before they gave you a bronchodilator or like an albuterol inhaler, or gave you a nebulizer therapy or something to decrease the inflammation in the lung, to see how you or your lungs respond to that particular medication. The other way is that you can have a chest x-ray so that we can look at the size of your lungs, so that we can see if there's anything that, anatomical that might be creating that issue. If the lungs are normal size, if the lungs are larger than normal or take up more space in the chest wall than they would normally take up, then we look at that. And then if you have been a smoker, or if you have a cough, and if you have shortness of breath, then you can also get a CAT scan, um, with and without contrast, if you present with symptoms. But if you've been a smoker, if you're over the age of 65, if you have smoked for more than 5 to 10 years, if you smoked more than 10 to 20 cigarettes per day, and again, over 65, you can have a CT scan for screening, a low dose CT scan. That's a screening test that we would do for lung cancer. But you can also do the same type of screening for COPD, or testing, because some persons who have COPD present with an abnormality that we see only on CAT scan called bronchiectasis, so an inflammatory or inflamed process that changes how the lungs are able to perform or create chronic cough and chronic sputum production. And those persons can also be diagnosed with COPD as well. So, what things cause or give us COPD? Smoking, cigars, pipes, cigarettes, and sometimes even secondhand smoke. For those of us who grew up in a household with people that smoked a pipe, people that smoke cigars, or some people that smoke cigarettes, unfortunately, we also are at increased risk for lung disease. Fumes or environmental toxins that can be found in the home, in the workplace, in an office building. Those things can be ammonia, asbestos, dust, smoke, specific type of cleaners or cleansers, sprays, And persons that might be exposed to mold or bacteria can also these will also be the particular things that can cause a COPD. Genetics. Yesterday, when I did a short video, we talked about alpha 1 antitrypsin. I called it a disorder, but deficiency. So if someone is missing this particular um, alpha 1 antitrypsin, then he or she might also develop COPD, but that would be a genetic cause, and that is also done as a laboratory test. If you don't have a primary care physician, or if you haven't seen a physician, then there is free geneticCOPDtest.com, and you can be screened or have testing to see if you might have COPD genetically engineered in your body. And are there things that might be comorbidities that might suggest that you should also ask your primary care physician to be screened for COPD? The answer to that is yes. Hypertension, diabetes, hyperlipidemia or elevated cholesterol, and hypertension is high blood pressure, and diabetes, high blood sugar, obstructive sleep apnea. So that person might have a cough, that person might snore, that person might also stop breathing. Depression, osteoporosis, arthritis, cancer, and then there are other medical problems that might also predispose you to have the same concern with being screened for COPD. So again, this is COPD Awareness Month. I have on my orange scrubs to represent the color for COPD. And we talked about a screening test. We talked about the symptoms. We talked about the types of COPD. We talked about tests that you can have done for COPD. And then we talked about the things that cause COPD, as well as comorbidities for chronic obstructive pulmonary disease. It is I think it's the sixth leading cause of illness in the United States of America. I believe that's what I saw when I was looking at my computer earlier. Um, and so it is just imperative during the months of awareness that we try to encourage or educate people on what COPD is, what COPD looks like, and what things we might have done to figure out if we are predisposed to chronic obstructive pulmonary disease and how we might address that. And so when we talk about it, if you're a smoker, oftentimes we will, as physicians, ask you to stop smoking or to decrease the amount that you are smoking, to get tested if testing is something that has not ever been done, and to then have treatment with medications for your COPD if we determine that that is actually the cause of your cough, or the cause of your shortness of breath, the cause of your wheezing, or the cause of your, what else did we talk about? Chest tightness or your fatigue. Don't get confused and think that that's the only thing that can cause all of those things. Depending on if you have other comorbidities, you might want to also speak with your primary care physician about screening for heart disease, lung cancer, as we discussed, asthma, sleep apnea, and then the entity that we talked about when you get a CAT scan would be bronchiectasis as well. So for COPD Awareness Month, I have on, as I stated, my orange, and we are just discussing some small quote unquote factoids related to COPD and how and why we should be screened, what things you should look for, and how it may or may not affect your life or other person's lives. And so we just always want to make sure that we protect other people. And if you are going to smoke, smoke outside. Reduce the amount that you're smoking. Don't smoke the normal times that you used to smoke. Those are ways to try to discontinue cigarette smoking by making it more difficult for you to smoke as well. And so I hope that our short segment about COPD awareness in the month of November has been helpful. And I hope that persons will use the education presented to get screening, to get tested, and to make a decision about whether or not they should discontinue smoking as well. And a reminder that these aren't the only things that can cause a COPD. And so if you have a COPD screener that shows that your score is greater than 5, discuss it with your primary care physician, discuss it with a pulmonologist, or see an asthma and allergy specialist as well. And they can also start your testing to ensure that there are not other things that are creating that. And then they can also refer you to a pulmonologist if that is needed. So, are there any questions? So, if you are coughing blood, I see that in the comments. If you are coughing up blood, that is called hemoptysis, and that is related to either bleeding or infection. Tuberculosis can cause hemoptysis. Lung cancer can cause hemoptysis. Stress or inflammation, pneumonia could also cause hemoptysis or coughing up of blood. Sometimes, if you have reflux and you have microaspiration in your lungs, or if you have sinus drainage or a sinus disease, then that can cause it. But actual coughing up of blood or hemoptysis is more common with infection or lung cancer. There are some fungal infections that are common in certain areas of the world. Those things usually present with fever, less commonly hemoptysis, but hemoptysis, lung cancer, pneumonia, or tuberculosis would be the things to think about when you have that. If you also have weight loss and fever, those are also things to consider as well. And again, COPD is a treatable illness. It does not currently have a cure, but does not mean that we won't be able to develop a cure, because as long as there are physicians and researchers out there, and they're always trying to figure out or understand more and more about the human body every year, every day, every second, every minute of the day. And again, it is in the United States of America, it's the sixth leading cause of death, chronic obstructive pulmonary disease, and worldwide or globally, it is the third leading cause of death. So it is not anything to be taken lightly. If you are short of breath, if your life has changed because you are short of breath, then please be screened. Please speak to your primary care physician, and please take the measures that he or she recommends for treatment in the case where you are diagnosed with chronic obstructive pulmonary disease. That can be chronic bronchitis and or, emphysema, emphysematous in nature. Again, Dr. Bubbly, that's me, the unfiltered MD. I hope that you feel a bit more aware and that I provided some education for those concerned or for those who were able to listen in and for those who might play the replay. I hope you enjoy this short segment on COPD during November, which is the month of COPD awareness. Have a wonderful day. Have a wonderful remainder of your triumphant Tuesday. And don't ever stop learning. Don't ever stop listening. Don't ever stop seeking counsel related to your health and all things necessary to stay well educated and well informed about one or another organ system related to our bodies. The lungs are a huge part of how we exist because the lungs help us to breathe better and allow us to allow us to transfer oxygen throughout the body to ensure that we remain healthy and that we're able to move and that we are able to breathe freely and that we do well on a daily basis. It keeps us moving and alive. So keep learning, keep living, keep laughing, keep loving. Have a wonderful day and have a wonderful remainder of your week. Bye bye.